name is Sophie Ambrose. I'm the coordinator of the Clinical Measurement Program at Boys Town National Research Hospital, and I've also directed the Communication Development Lab. I'm very excited to be asked to present at the Research Symposium for A.G. Bell. I'll be talking about some of the research we've done in our lab on supporting families in optimizing their infants and toddlers' use of their hearing devices. So this is a kind of area of research that became really important to me after being a member of the Outcomes of Children with Hearing Loss team that Mary Pat Moeller and Bruce Tumlin were heading up. One of the things we learned as part of that study was that on average infants and toddlers were wearing their hearing aids about 4.5 hours a day. But on the other hand, we were seeing that optimal outcomes were achieved by children who were wearing their hearing aids about 10 hours a day. And similarly, and somewhat to my surprise, some work also by Dr. Elizabeth Walker, who was part of that team, who was doing some separate work with children with cochlear implants, also found that infants and toddlers with cochlear implants were wearing their devices about 5 hours a day. And so it was clear that what we were doing currently in early intervention isn't always meeting families' needs as it pertains to device use. And so we set up a program of research to figure out how to address that. So in my talk, I'll be talking about kind of 3 different pieces of information. So the first is about the tools that we're using in our lab to better understand what the barriers are that families are experiencing as they work to optimize their child's device use. And then in the second set, I'll talk a little bit about some of the data that we've collected from using those tools. And then finally, I'll talk about Ears On, which is the early intervention approach that we've developed based on those findings, and a little bit of the evidence for that approach. In terms of tools, one of the things that we do is we've used tools to ask parents about what the barriers are that they are experiencing. And so I'll share that tool at the conference, but one of the kind of highlights was that we asked them about 15 barriers to device use and how often they experienced those in the past month. And we were surprised to see that on average, families are reporting experiencing 6.5 of those barriers. So we're seeing that even though sometimes those are rare in terms of how often they're experiencing them, altogether that really adds up. So another thing that we use is called the SPIES-R. So that's the Scale of Parental Involvement and Self-Efficacy Revised. So that's a tool that was originally developed by Dr. Jean Desjardins, and we've revised it so that it now asks parents about their beliefs, their knowledge, their confidence, and their actions pertaining to supporting their children's device use and their language outcomes. And so there we're able to ask parents about some of their beliefs and figure out which of those might be leading to their child not having their devices worn as frequently as they might otherwise. So things such as we're finding it's not an uncommon belief that parents think that if their children wear their devices all the time, they'll become dependent on those, for example. Asking about confidence really helps us to see when we're giving parents lots of information, but maybe not giving them the practice to turn those into actual skills they feel confident in doing. And asking about actions lets us see when maybe they have knowledge and confidence, but they haven't figured out how to fit those into their daily routines. So we use all of those tools and some other ones to kind of understand what each family's individual needs are when we're going to do our Ears On intervention. So we always start with an assessment. That also includes another piece that I like to mention, which is a practical hands-on test of their hearing skill management, because that's often a place where we can kind of identify some places for improvement. So, but we do that assessment, figure out what some of their barriers are. Then every family participates in a workshop. The workshops are really individualized based on the child, but all of them have the same 4 goals, which is to make sure parents understand their child's hearing loss, understand the impact that that hearing loss will have on speech and language development without consistent hearing device use. Number 3, that they understand that hearing devices are a way to reduce that risk that the hearing loss presents for development. And then finally, we make sure that parents walk away feeling really empowered, that they understand that with just a little bit of coaching and tools, they're going to be able to really optimize that device use. So in the presentation, I will share some of the evidence for the approach, but I'll also share a lot of those really practical and evidence-based tips that we're finding have been really integral in terms of the intervention. So hopefully, if you can make it to the presentation, we'll be able to send you home with some tools, some evidence-based strategies, and hopefully have some good discussion about other things that we can be doing to support families. So I'll look forward to seeing you in Madrid.